As a delivery driver, you're on the front lines of the global COVID-19 pandemic. You keep goods flowing to stores, hospitals, homes, and other critical businesses. Your job is always important, but never more than now. This course will give you the information to keep yourself safe and help stop the spread of COVID-19. You'll learn about the symptoms of COVID-19, how it is spread, and how to protect yourself and others. We'll cover specific ways the pandemic is affecting delivery drivers and provide you with helpful online resources that will have updated information on this fast-moving situation. Doctors are still identifying symptoms of COVID-19, but the most common are fever, persistent dry cough, shortness of breath, chest pain. What should you do if you have any of these symptoms? If you're working, you need to contact your manager or safety team. Like any other medical emergency, they have a playbook and they will help you. If you're already on home time, contact your employer and stay home. In both cases, you'll want to contact your healthcare provider to start care and get tested. While most people who get COVID-19 have mild to moderate symptoms, about 20% need to be hospitalized. Hospitalization is a higher risk for those over 60, people with diabetes, lung or heart issues, or people with compromised immune systems. COVID-19 is both robust and highly contagious. The main way it spreads is through respiratory droplets sprayed when someone who is infected coughs or sneezes. The virus can survive on surfaces for hours and even days, so you can catch the virus by touching your own mouth, nose, or eyes after touching a contaminated surface. So, let's talk about prevention. First, wash your hands often with soap and water for at least 20 seconds. You should try to do this any time you've been in a public place or after blowing your nose, coughing, sneezing, or touching any potentially contaminated surface. If you don't have soap and water, like when you get back into your vehicle, use hand sanitizer with at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Finally, cough or sneeze into the crook of your arm, rather than covering your face with your hands. We've all now heard the term social distancing. That means limiting physical contact and proximity with other people as much as possible. This means trying to limit your contact with customers and clients where possible and sanitize your hands after every interaction. You should avoid groups and minimize visits to public places like grocery stores and restaurants. If you must be out in public, try to keep at least 6 feet between you and other people. In addition to the social distancing recommendations, keeping at least 6 feet away from others and avoiding areas of social gathering, the Centers for Disease Control and Prevention strongly suggest wearing a face mask while in public. Wearing a face mask not only helps protect you from getting the COVID-19 virus, it could help prevent its spread if you already have it but don't show symptoms. What type of mask is recommended? The CDC suggests wearing face masks made from multiple layers of cloth or fabric secured with ties or ear loops. They should be machine washable without being damaged or changed and should allow you to breathe unrestricted. The CDC is not recommending N95 or surgical masks, as those are crucial supplies for medical workers. Removing and washing. When securing or removing your face mask, take extra care not to touch your eyes, nose, mouth, or any part of your face. And remember to wash your hands immediately after removing. You should wash your mask regularly in the washing machine. Making your own mask. There are several ways to make masks depending on your supplies. Please follow the accompanying link for instructions on how to make them. Masks can be constructed using cotton fabric, elastic bands, and a sewing machine, a t-shirt and scissors, a bandana, coffee filter, rubber bands, and scissors. As an essential worker, it's critical you do your part to prevent the spread of COVID-19. Wearing a face mask can protect you from getting or giving the virus to someone else. For more details on making, wearing, and cleaning your face masks, please visit the CDC site, www.cdc.gov/coronavirus/2019-NCOV/prevent-getting-sick. Let's talk about specific ways you can stay safe and stop the spread. Whenever you start your shift or change vehicles, use bleach-based or alcohol wipes to clean door handles, steering wheel, turn signals, wipers, dashboard controls, shift lever, and interior door panels. When you're out of the vehicle, you should wash or sanitize your hands after touching anything, but specifically high-touch areas like vehicle door handles, fuel pumps, doorbells and doorknobs, public facilities door handles, any desk or countertop, phones or handheld devices, ATMs, cash, paperwork and pens, break rooms, except for hand washing, and vending machines. With increased residential and home deliveries, you need to take extra precautions if you happen to be delivering to or servicing these environments. Many companies have adopted a no-touch delivery approach. Preventing handoff of packages helps maintain social distancing. If possible, avoid taking cash by using advanced pay for service. Some facilities may limit access to only residents or workers. If you're needing access to such a facility, such as an urban apartment building or office, make sure you have the instructions necessary or provide your arrival time. This will help prevent spread of the virus by limiting your exposure and save time. You may already know how important it is to stay alert. You may be working longer hours and have less time off between shifts. In these challenging times, it's more important than ever to watch out for fatigue and distractions that could affect your safety and others. With everything going on, your mind may wander and you may find it harder to sleep. So be aware of fatigue and signs that you're becoming sleepy. If you're tired, park in a safe and legal place to take a break, and contact your manager if you will be delayed with your delivery. Beyond feeling fatigue, you may feel more distracted than usual. Given the situation, it is normal to worry about your family and the turmoil on the news. While you can't control what's happening in the world, you can control your reactions to it and stay focused on the road. Other drivers around you might also be more distracted, making it vital for you to maintain focus when you're behind the wheel. There are several up-to-the-minute, reliable sources for information on COVID-19, including the CDC website. Your own company, too, is committed to your safety. We strongly recommend you check in with them regularly to get updates. This is a new situation for you, your coworkers, and the whole world, but we can get through these difficult times by remaining vigilant and taking pride in our vital role of keeping the nation moving during these times of need. Thank you for all you do. Stay safe out there.